So the reason I like working here is because you get to see someone at their most vulnerable time and try and make a difference. So working with the patient and the family and the whole interprofessional team, it's very collaborative in the ICU, and you kind of start when someone's at their most vulnerable, worst time in their life, and you get to see them progress from there. So whether it's starting with small things like range of motion, positioning, secretion clearance, and then working on more strength and mobility, you kind of get to see that progression, and it's very team oriented in the ICU.
So my recent love has become the ICU. I just love the complexity of the patients, the amount of lines and tubes, working in an interprofessional setting where you're constantly collaborating with respiratory therapists, nurses, the physicians to really help the patients in their most vulnerable time when they're the sickest that likely they've probably ever been. You get to work really closely with families too that are in here. So to me, that interprofessional aspect of the ICU and the complexity is the biggest reason why I love the ICU.
My favorite unit, I do like vascular because the amputees are very interesting. You get a lot of complex patients. There's never really a dull moment. You can get some strong personalities, but you can get that anywhere. So over there, I'd say it's the most variety and the most interesting. It's also the only vascular unit in Calgary, so it's unique to this hospital. But I do enjoy the pace and the workflow on ortho. And it is quite unique because in both, a hip fracture or an amputation or kind of anything major like that, the wins are really big when you get them. So regardless of what I'm treating, I like those two because the wins are pretty huge and the impact you can have on people is pretty big. Whereas here, a lot of times you're one of the first people who sees someone after a pretty catastrophic injury or pretty catastrophic life event, and they are mentally and physically at some of the lowest points of their life, and you're a big piece in building them back up, both like mentally and physically. So the wins are really big. You get a lot more happy tears here than you do in private practice. Partially is the type of work I like to do, but more so the big wins.
So the thing that I love the most about working in acute care is that I get to work closely with patients and be a part of their journey to recovery. So starting from day one, seeing patients being in the bed, starting with bed exercises, progressing into sitting, standing, and eventually like walking or negotiating steps. It's really rewarding when you see patients get discharged and walk out of your unit. And so it's a rewarding thing to see as a physiotherapist.
The thing I like about acute care is you're never alone. You always have support from team, rehab team, and multidisciplinary team. And I think it's very important when you're starting a new practice. You get the privilege to see patients in their difficult time and ultimately make impact in their life and the healthcare system. There is no such typical day in acute care. Every day is different and interesting. High-paced environment, dynamic and wide variety of patients, quick turnover, teamwork and problem solving, which makes the days interesting.
I really enjoy working here because I feel like it's a little bit of atypical physiotherapy. I think that our specialization allows us to expand that scope of practice with physiotherapy, and that we also get to work a bit more with the medical team as well. So on our team, on that unit and also in the outpatient burns clinic, we also get to work with a physiatrist, a burns nurse practitioner, and a whole handful of nurses that help us to do our job best. And in the case of myself, where I work on the burns unit, I get to explore things like wound healing and dressing takedowns and all sorts of things that people wouldn't typically think of physiotherapy. I know that a lot of people typically think of like hips and ankles and backs when it comes to physio, but our scope of practice with the wounds and plastics team allows us to push that scope of practice a little bit more.
Yeah, I'm a rotator physiotherapist at Foothills Medical Center, which means basically I change teams every 6 months. There's a rotation of 7 different teams that we go through, so it takes 3.5 years to do a full rotation. And it includes teams from a variety of practices throughout the hospital. So as a new physio, I knew that I wanted to work in a hospital, but I didn't know what area I wanted to be in. And being a rotator really gives me the opportunity to really try my hand at almost all the practice areas here at Foothills, which is quite a bit. And it also allowed me to kind of build my foundations in lots of different areas. Our patients are almost never just one-dimensional. They often have multiple health issues going on, or multiple reasons that brought them to the hospital. So having that foundation and kind of my physio toolbox was really intriguing to me. I am really enjoying the burns team right now. It incorporates a lot of different aspects of practice with both outpatient, inpatient, lots of team dynamics, lots of working with the team. I also really enjoyed my time on the cardiovascular and thoracic team. And I enjoyed my time in ICU. So as you can see, I'm still very undecided. So rotator is right where I'm meant to be right now.
My name is Ravi, and I work at Foothills Medical Center. I'm on the general medical unit. The unit's population is often adult geriatric. I enjoy working with that population. I find them very interesting. They come from all different backgrounds, and I enjoy spending my day with them. Prior to coming to the hospital, I worked about 13 years in private practice. That's where I first started out of physio school. The reason I went into private practice was that's most of the area I knew going into physio school. I enjoyed it. After about 12-13 years, I felt like I wanted to change. The nice thing about a physiotherapy degree is you have the ability to change and work in a different area. So I approached the hospital. I started in orthopedics here, so your post-op hips and knees, something that they felt was an easier transition for me coming from private practice to seeing those patients in the hospital. Then I went and saw some patients on a general medical unit and thought, I really like this type of population. I really like the role I can do here. So I switched over to that type of unit, and I've enjoyed it ever since.
My name is Matthijs van der Lucht. I'm a physiotherapist at the trauma unit, Unit 44, Foothills Medical Center. I believe it to be the most special and exciting unit at Foothills Medical Center, but that's my personal taste and preference. And the reason why is it's the complexity. It's the variety. We get complex musculoskeletal injuries, multiple fractures, we get neurological injuries where the spinal cord or there's a traumatic brain injury involved in this case. Often organs are involved as well. We need to have a look and see what the function is of heart and lungs. So the diversity makes it very interesting, and there's many cooks in the kitchen. In this case, you end up working with so many different specialists, physiatry, trauma surgeons, spine surgeons, neurosurgeons, on and on and on, which makes it a lot of fun. That makes it multidisciplinary. And for me, because I have so much affinity with biomechanics, physiology and anatomy, I get to brainstorm and be creative with all these different parts of my job every single day, never a boring day. And I was with Cirque du Soleil, doing that for a long time and traveling around the world as well. This is different, though I have to say trauma is almost the same as circus. There's so many people coming together, having to be creative and empowering people.
And I've been in practice now for 40 years, and I'm now working here at the Peter Lougheed Center in the emergency department, and I really love working here. After the places that I had worked in the West Central PCN here, I had worked for the Chronic Pain Center, I had done sports medicine and all these different things, and ironically enough, all of those skills came to sort of be appreciated in Emerge. And then I found sort of a great opportunity to use my skills or my experience to help the doctors. And I don't mean to suggest that they needed help, but there were many times when they would say, can you see this patient for us because we don't know what's going on, as an example. And they ranged from seeing patients who the doctor had indicated it was X, and it turned out to be cauda equina, and we're ordering an MRI and pushing them off to the Foothills Hospital. There were opportunities like that I just happened to really have a chance to do what I enjoy, and it continues to be that way because they're looking for help. They've got a problem. They value us and viewing that this is the expert team, a team of experts who can maybe help me. The challenge that we have in the Emerge is that some patients take a long time. So from that standpoint, it's not necessarily a reflection of how the work we're doing as much as we have to spend a lot of time on it. But on the other hand too, when you see patients that can be discharged, it is a fast pace, there's no question. So you're juggling sometimes 3 and 4 patients, you've got this one over here and this one here, and you're trying to help them get up or do different things.
My name is Darcy Duquette. I'm a patient in the Alberta healthcare system. I had a surgery that didn't go well, and I ended up septic, and I ended up 5 weeks in medically induced coma. And when I came out of that coma state, I entered into the physiotherapy program. The first couple of days, they would sit me up in the bed, and you know, a newborn baby, their head there's no muscle in their necks. Well, I was the same way. I couldn't even hold my head up, so they would work with me with that, and then they'd sit me in chairs so I could learn to sit up again, and then I progressed from there, moving my arms and then moving my legs again, and then learning to walk, learning to go upstairs and downstairs, and just how to get out of bed, or actually making sure they worked my muscles so that I could get out of bed. Kindness it always comes to mind with physiotherapy, and I think it's a very selfless act of kindness that they do for me, because they were managing my success in a positive recovery, and I think that was probably the most important part of getting out of the hospital, was learning to walk and learning to be independent again, right? And you're very dependent on the physiotherapists and the whole department, to be honest with you, because they come talk to you, and they would, like I say, they're like angels to me, getting me back to a point where I could get out of the hospital. With physio, I went from 0 or next to 0 muscle mass to a point where I could walk again, walk upstairs, and I'm 10 years later, and I still progress every day, to be honest with you, because of what I was taught with the physiotherapists. Because they did impact my life to the point where would I be now if I didn't have the physiotherapists, right? They were, would I be in a long-term care facility, or where would I be if I wasn't functional? I know I have my wonderful wife, but and she was always by my side, and she still is always by my side, but I think you know, there's only so much that you can ask of your caregiver, and I think physio played a huge role in my success.